Uh, Good morning, everybody. I am going to present on my work on hydrogen sulfide as a potential angiogenic factor in diabetic retinopathy. So it is this research project was approved by ICMR, and I don't have any financial interest to disclose. So coming to background, hydrogen sulfide
Can you
is
put on the slides, please?
Sorry.
Slides. और timer सर फिर से start करें.
Yeah. Good morning, everybody. So I'm going to present on my work on hydrogen sulfide as a potential angiogenic factor in diabetic retinopathy. It's a research project approved by ICMR, and I don't have any financial interest to disclose. So going to background, hydrogen sulfide is one of the most recent additions in the endogenous gastrotransmitter family, along with nitric oxide and carbon monoxide. It's found to be protective for cell viability at physiological concentration, but cytotoxic at higher level. Its overproduction may lead to beta cell death in diabetes. So with high blood glucose, there is activation of the pancreatic cystathionine gamma lyase overexpression, which causes neutralization of the oxidative and nitrogenative stress and autoimmune attack, which is a protective mechanism. But as a result, there is hydrogen sulfide is accumulated in islet cells as a byproduct, which then activates ATP-sensitive potassium channels and decreases insulin production, ultimately leading to high blood sugar again. So when this hydrogen sulfide reaches its threshold level in beta cells, it causes progressive apoptosis of the beta cells. So hydrogen sulfide in a hyperglycemic endothelial cells shows increased rate of hydrogen sulfide consumption due to reactive oxygen species generation. ROS from hyperglycemic mitochondria consumes intracellular hydrogen sulfide, which then creates additional mitochondrial dysfunction by oxidative modification of the mitochondrial proteins. It is also found to act on angiogenesis. Addition of hydrogen sulfide in experimental models have shown endothelial cell proliferation, migration, and tube formation, while inhibition of H2S production attenuates these processes. So, while most H2S-mediated angiogenesis phenomena have been extensively studied in experimental models, it has not yet been investigated exclusively under conditions of hyperglycemia or diabetes-related microvascular angiogenesis, which remains an interesting research direction. So, coming to objectives. So, the objective of the study was to quantify hydrogen sulfide level and VEGF level in plasma, aqueous, and vitreous samples of patients of diabetic retinopathy of very severity, that is NPDR and PDR, and to correlate H2S and VEGF level with blood glucose level and severity of retinopathy, and to correlate the findings with age-matched non-diabetic population. So coming to methodology, it is a prospective study. Treatment patients of diabetic retinopathy without systemic complications scheduled for anti-VEGF injections with prior informed consent were recruited for the study. Non-diabetic patients scheduled for macular hole surgery, ERM removal, and planned acceptable was included as control group. Systemic conditions, relevant systemic conditions were checked and standardized to comparable level, and strict inclusion and exclusion criteria was followed. So these are the clearance of the study from the Institutional and Research Committee, Ethics Committee, and Biosafety Committee. And this is a standard patient consent form signed by patient and attendant. So 30 cases from NPDR, PDR, and control each group. Out of total 90 was recruited for the study. Vitreous aqueous samples are collected by 30 gauge tuberculin series, whereas vitreous samples is collected by 27 gauge Carter, and plasma was collected in EDTA. H2S concentration was determined on the day of sample collection by spectrophotometry, whereas samples are stored for ELISA analysis of VEG estimation. Standard statistical tests were applied to analyze the data, and less than 0.05 was considered as statistically significant. So this is the final statistical analysis data. So HbA1c was found significant in all the three groups, that is PDR versus control, and PDR versus control, and NPDR versus PDR group. Fasting blood sugar was also found to be significant in all the three groups. H2S in AC tape was found significant in PDR versus control and NPDR versus control, but not significant in NPDR versus PDR group. H2S in vitreous tape was also not found significant in NPDR versus PDR group. Hydrogen sulfide in plasma was similarly not found significant in NPDR versus PDR group, but in the other two groups it was found to be significant. VEGF in vitreous was also not found significant in NPDR versus PDR, but it was found significant in the other two groups. And VEGF in plasma was found significant only in PDR versus control group, but it was not found significant in the other two groups. So coming to discussion, experimental evidence shows hydrogen sulfide overproduction as a causative factor in the pathogenesis of beta cell death in diabetes. Evidence supports the role of H2S in the pathogenesis of diabetic endothelial dysfunction, diabetic nephropathy, and cardiomyopathy. While most of the existing data is on the role of H2S on microvascular environment, there is paucity of data on the potential effect of H2S on intraocular microvascular complications related to diabetes. In this study, we have compared H2S level with blood sugar level and VEGF in both NPDR and PDR with control population. H2S level was found to be increased in intraocular environment as well as blood of patients with varying severity of diabetic retinopathy. It was found to be comparable with VEGF and blood glucose levels. While H2S level was found to be more in PDR comparison to NPDR cases, it was not found to be statistically significant. Coming to conclusion, current study may give some insight about the complex pathological process of diabetic retinopathy and H2S as a novel biomarker in the process. There is scope of future research to explore significance of H2S in the complications related to diabetic retinopathy, which may help to explore newer treatment modalities for managing these potentially blinding conditions. So I'd like to acknowledge Dr. Prithivi Sukumar from IIT Guwahati for his technical support, my co-investigators, and my research assistant and my fellows. Thank you.
So you have collected vitreous samples even from NPDR patients.
Yeah, while giving an intravitreal anti-VEGF, we just collect.
But you have used a cutter, like
27 dose
any
cutter.
vitrectomy or any such. This procedure was actually not indicated in these patients.
Yeah, that is why we need to take a proper consent from the patients, and all of us did under video monitoring.
Okay. And all the groups you have 30 patients each.
Yes.
What was the repeatability and reproducibility of that spectrophotometry?
Yeah, it is reproducible.
Did you?
Yeah, it is all the data is reproducible actually.
So if you do it again and again, the reading came out to be same, or first reading or 3 readings, or
No, this was actually this particular wavelength is fixed at the initial few test samples, and then it is reproducible.
So even after few days, you were clear about the data that you were getting.
Data is safe, but same sample we can see this test only within 4 hours after collection of samples. We cannot do it after 4 hours. It need to be the different data will come.
For the patients for whom you took vitreous sample in NPDR, was there any other indication of vitrectomy, or you just took informed consent and took the sample?
No, only all the cases with first time giving anti-VEGF we collected the samples.
Just the consent was the main part.
Yes.